Hey Crowns, this is Brad James from Kleer. I hope everyone was able to enjoy the holiday season and that your new year is off to a great start. At Kleer, we really value and love the culture of success that Crown Council dentists have built for their peers, for their team members, and also the amount that you guys give back to your respective communities. It's really what drew us to the Crown Council, and we are proud to be a Crown Council resource partner for a second consecutive year. And for those Crown Council members who are also Kleer customers, we appreciate your support and feedback, and please continue to give that as we continue to innovate our platform. And lastly, for those Crown Council members who may be considering joining Kleer soon, whether you're doing an in house membership plan or maybe you're using another third party, please feel free to contact us as there are no fees to get started with Kleer. So there's no implementation fees, there are no standard monthly fees, and Crowns will receive a 15% discount on Kleer fees. For the presentation, I'm going to be sharing a lot of research and data. So it's going to be fairly educational and it's going to pertain to not only membership plans, but it'll touch on the dental insurance market, it'll touch on patient mindsets, and lastly, it will also cover what we will be rolling out in Q1 of 2021, and we're really excited about it. And it's called Kleer Employer Care. This will be a way for you to be able to go out to small businesses and present and customize employer care options so that they can present these to employees, and hopefully this will bring new patients to your practice. For, before we touch on that though, I would like to first touch on what a membership plan exactly is. Maybe you need a quick refresher, or maybe this is a completely new concept for you. On the right side, this is an example of a membership plan specific to that practice. It's not like the traditional PPO model or traditional discount plan model where a third party is essentially dictating the fees and pricing that you set for your patients, and they're also dictating the treatment protocol. No, this is different. This is where we're empowering the dentist to be able to offer dental benefits directly to their uninsured patients at a monthly or annual subscription. And as you can see, for the patient, they will be receiving their cleanings and checkups as a perk for being a member that is included in their hygiene care. And additionally, if they need any other procedures outside of their preventive and diagnostic care, they will receive a discount for being a member at your practice. And this is great because you are now in control to customize care plans for your patients, and it's going to create a long-term mutually beneficial relationship that is going to promote loyalty to specifically to your practice. What I also would like to cover is some research and data that really built the foundation of our company. If we're looking at the dental insurance market in general, we're actually seeing that it generates around $75 billion of revenue each year, and only 60% of that is going to patient care, which means that out of $75 billion, only $45 billion is going to patient care. So where does the rest go? And if we're looking across the United States, we're seeing that the vast majority, actually around 99% of all dentists, are seeing declines in reimbursement rates. And to make matters worse, according to Morgan Stanley research, it's only to continue to decline year over year. So nothing's getting better. And to really compound on that, and if we're getting topical with COVID-19, we're seeing that the expenses for your practice are increasing with PPE and infection control. And it's simultaneously being coupled with the fact that production is decreasing due to patient and social distancing. So what we're seeing right now is essentially the perfect storm of how the high volume PPO model, traditional model in dentistry, is becoming more and more obsolete. And to show that even further, the fact that the cost of PPE and infection control. It just shows the misalignment between the dental insurers and the practices, and matters are just continue to get worse. And dental membership plans are a great solution to have in place to combat this. But before we kind of dive into specifics of the membership plan, I want to show you why it's a great opportunity for your uninsured patients. And the reason is because we're seeing after the peak part of the pandemic, we're seeing that 30 more million Americans have lost their dental insurance. So that brings us to a total of 50% of US adults not having any dental coverage. And what we saw even prior to COVID, this is really what built the foundation of our company and made us decide that we wanted to go in membership plans, was we saw that there's a huge discrepancy between uninsured and insured patient behavior. In fact, we see that uninsured patients come in 2 to 3 times less than insured patients. And on top of that, we're actually seeing that when these uninsured patients finally do decide to come into your office, they're accepting 50 to 75% less treatment. So they come in less frequently and they accept less treatment. And we wanted to figure out why at Kleer. So what we did was we conducted a focus group where we brought in hundreds and thousands of uninsured patients. And we basically wanted to figure out, why are they coming into your office less and why are they avoiding treatment? And the two biggest reasons were, basically, it all stems from the fact that dental insurance is complex for these patients, and they overvalue the fact that they don't have dental insurance. So they think that without any coverage, it's going to be too expensive. And secondly, they don't see the point of coming into your office if they don't have any coverage and if they don't have any tooth pain. But the silver lining here is that we asked the same focus group, okay, if your dentist was able to offer you something that's simple, transparent, and affordable, what's your level of interest? And we saw that 90% of these patients express some level of interest to join your practice. And basically 75% were moderately interested to extremely interested. So this is a huge value prop if you're able to implement a membership plan and implement it correctly. What we're also going to look at here is what we call the membership club effect. Now, what's interesting is we always want to take into account of what are dental practices doing. What are these prospects of ours doing for their uninsured patients prior to even implementing a membership plan? And there's 3 popular options. We see that there are new patient specials, which are essentially Groupons. And what's bad about these is that you're commoditizing the care that your practice is bringing to these patients. You're offering these new patient specials at a really cheap rate. And what we're actually seeing is it creates almost a revolving door. This patient, as soon as they step foot into your office, receive their care, you are most likely never going to see them again. So it's not really promoting patient loyalty. And to build on that, the second choice really does the exact same thing. And what we're seeing is that some practices offer arbitrary discounts to their uninsured patients. One patient may not get a discount at all, while another patient may just receive a random 10% discount. And the problem with this is that the patient, there's no perceived value for that discount. They don't understand why they're getting it. They don't know if they're special, if it's the norm, and that too does not promote patient loyalty. And the third option, which is probably the worst, and I think everyone here would agree with it, is that when uninsured patients join some type of dental discount plan or they join some type of low-cost insurance plan. And this is just probably the worst case scenario for patient and practice, because for you, you're basically voluntarily handing over an uninsured patient to an insurer, and you know that you're probably going to get poor reimbursement rates for those types of plans. Now, a dental membership plan is going to be invaluable in this situation, especially if you don't have anything set up and your practice is offering one of those three options that I just covered. Because what we're seeing here is that a membership plan is going to improve cash flow. And something that a lot of people were pushing out throughout the pandemic when businesses were closed was that cash flow is king. Because ultimately, in your situation, when your doors were closed, unless you had a membership plan, you were probably struggling with revenue coming through with revenue. And what a membership plan does is it's going to generate consistent recurring revenue. Now, if you want to identify with how many uninsured patients you have and how many you can probably see signing up for this, just think and affiliate yourself with this. You know, if you want to get 100 uninsured patients on your membership plan, that could be 2,500 to 6,000 a month, and that's only on subscription fees. That does not take into account with case acceptance. And we're actually seeing, I'll cover in a minute, we're seeing that your membership plan patients are going to be accepting far more treatment than your uninsured patients. And to build on that, let's just take a step back from dentistry real quick, and let's just think about the U.S. economy and the global economy right now. And you're seeing so many different businesses create some type of subscription service, whether it's a rewards program or a loyalty program, or maybe it's just a subscription service like a Netflix or a Spotify. I mean, you're seeing now more businesses offer these services than don't. And the reason is because they understand that loyal consumers or loyal customers spend 2 times more than those that are not. And additionally, I think everyone is familiar with the fact that it takes a lot more spending to draw a new customer than to retain a loyal one. So that's why you're seeing so many different businesses shift towards this model, and dentistry should not be an exception. So a lot of practices either try to do a membership plan themselves, or maybe they use another third party, or maybe they did implement a plan and they were struggling with it in some sense and they kind of just gave up altogether. What our mission is at Kleer is we want to make sure that we're partnering with your practice to make sure that your membership plan is going to be successful. So we're going to provide an excellent user experience for your front office team, for you, and for your patients. And we are constantly updating our technology and innovating our platform. You know, the big picture here for your front office team, since they're going to be working in our platform day in, day out, is we want to make sure that we're automating as many processes and streamlining this so that it can be scalable. Additionally, we have a customer success team that you can always turn to as a helping hand when you need any type of support, when you need any type of recommendations, tips, or tricks when it comes to having a more successful membership plan. And lastly, there are a lot of different features and perks that we can bring to make your membership plan more successful. Some people value the HIPAA compliance and the state and federal regulations that we have followed. Some people value the marketing materials and library that we give you access to for free. Each and every practice has their own perk. And if you haven't explored our platform, please feel free to always contact me and we can always run you through it. But what's more important is the fact that if we're thinking back on what I was covering about the subscription economy, we're talking about all these businesses that are implementing membership plans or loyalty programs because they know that loyal customers spend 2 times more. And I said that dentistry shouldn't be the exception. The reason I said that is because we have been conducting research with our customers because we want to see the ROI that our membership plans are bringing to our customers. And the crazy part is we're seeing that Kleer patients are generating 2.1 times more net production than those other uninsured patients at their practice, which is really spot on with what we're seeing with the subscription economy, how loyal customers spend 2 times more. It's the same thing with dental membership plans. these loyal patients are accepting more treatment, they're spending more, they're visiting more frequently, and altogether, they're essentially doubling their profitability within your practice. So now that we know that membership plans are a great solution, especially now more than ever, and that you want to get as many of your uninsured patients on there as possible, especially since it promotes loyalty, it is profitable, and it makes your patients happy and gives them peace of mind. I also would like to share with you that this exciting feature that we're rolling out called Kleer Employer Care. Now, before I touch on our specific solution, I wanted to share with you a lot of the research that we conducted and basically give you a summary of where the market's at. And what we're seeing is that dental benefits are valued by employees at companies or just any type of consumer or patient. It's actually the third most requested benefit when it comes to employees behind medical insurance and 401k plans. And that's essentially why employers offer these dental benefits to their employees. And right now we're seeing that it is the main channel. It's the main way that how your patients are obtaining these dental benefits. It's because it's sponsored by the employers and they know that their employees value this. But the problem is that the market is stagnant, and it's because five dental insurers control a large portion of the market, and we're also seeing that the market's extremely inefficient. Similar to what we covered early on with patient care and how 75 billion is generated, but only 45 billion of it is going to actual patient care. The same thing's going with employers. Employers are spending close to $100 billion on dental insurance premiums every year, and only about 60% of it is going to dental care. So I guess those dental insurance companies love the 60% number, but no one really knows. I guess they're pocketing that other 40%. So right now, the market is slow, it's stagnant, and there's been a huge lack of innovation. And now more than ever, it's needed, especially post COVID, where we're seeing that now close to 50% of the U.S. adult population does not have access to dental benefits. Now, what we did at Kleer was similar to what we did with the uninsured patients. We brought together small business owners in a focus group, and we wanted to figure out how would they feel about employer care, Kleer employer care, or a dental practice offering a membership plan to their employees. And what's funny is when we're looking across the market, especially with small businesses, those that have 50 or fewer employees, usually it's around 50% do not offer benefits to their employees. And as you can imagine, I don't want to beat the dead horse here, but it's where we're at as a society right now. COVID-19 has only decreased these numbers. We're seeing that for small businesses that don't offer dental benefits to their employees now, over 80% said that they were interested in offering dental benefits in the future. So although they don't do it now, there is interest of offering it in the future. And what I thought was actually pretty surprising was 90% of blue collar small businesses said that they intend on offering dental coverage to their employees. And even with white collar, we're seeing close to 70% are planning on offering these dental benefits to down the road. And why would these small businesses want to offer dental benefits to their employees? And the reason is they understand the value. The first is that these small businesses want to show their employees that their leadership team cares about them. Second, they know that it promotes a healthy lifestyle for their employees. Third and fourth, they know that it helps retain and attract talented employees because, like we said, employees, dental benefits are their third favorite benefit that they look for. And then lastly, since these employees really value their dental benefits, they want to make sure they're holding on to them and that they're staying at that employer that's offering these benefits to them. Now, With Clear Employer Care, there's two goals that we have, two big goals. The first is similar to what we do with the direct to patient model that we have right now, and we want to cut out the middleman. Not only do we want to help out your practice, but we want to save employers and employees money. We want to make sure that we're building this loyal relationship between employer and practice, and that the payments are going directly to your practice. Also, we would like to remove any unnecessary hassles that come with insurance for the employees and employers. So we want to get rid of these complicated terms like deductibles, maximums, pre-approvals, etc. And then on top of that, a great segue is that we really want to make it easy for the employee and for the employer. So we want to make it a fast, simple online enrollment. We want to make sure that there's no minimum participation requirements or funding levels. And lastly, we want to make sure that we have a user-friendly platform for the employees to easily navigate for enrollment and management of their care plans. So if you want to look to the left, this is just an example of a screenshot of what these employer care plans will look like. And what we're going to be doing here is with the care plans, you can standardize or customize them. We're going to make it easy for everyone to manage in the Kleer portal. So your practice will have their own employer care model. The employer will have their own user interface, and then the employee will have their own interface as well. We will also be providing your practice with everything you need to market and advertise your employer care plans. On top of this, we've also made sure that we've checked the box with not only HIPAA compliance, but with ERISA, COBRA, and direct primary care. And lastly, like I said, we want to make sure that this is easy for everyone to navigate on a user-friendly platform. So we're going to set up the employer and employee portals to make it easy for them. I know that was a lot of information, and I want to thank you so much for your time. We really do love this partnership with the Crown Council. And if you have any questions or concerns, please don't hesitate to reach out to me. This is my email, just brad@kleer.com. And that is also my cell phone number. You can call or text. And additionally, if you are interested in learning more about the employer care solution, it doesn't matter if you're a customer or if you are a prospect of ours. It's something that we're rolling out that's new. So please contact us. And additionally, if you do want a demo, we're always happy to have a conversation, and we can help figure out how we can create a membership plan that's personalized for your practice and for your patients. Thank you again. Enjoy a great year and enjoy the rest of the annual event. Thank you.